We're going to take a closer look at ISMP's recent efforts to create targeted medication safety best practices, which encourage all hospitals to implement uniform safety recommendations. ISMP has developed targeted medication safety best practices for hospitals. These best practices aim to identify, inspire, and mobilize national adoption of best practices on specific safety issues that cause fatal and harmful errors in patients. These errors continue to occur despite repeated warnings in ISMP publications. These best practices are realistic, to the point, and easy to implement. Joining us now is pharmacist Daryl Rich, who is a medication safety specialist for ISMP. He coordinates the Best Practice Initiative and is the administrative coordinator of ISMP's Medication Safety Officers Society. Daryl is here to explain some of these best practices that hospitals can focus their safety efforts on over the next 2 years. Daryl, welcome. Thanks for being here.
Great to be here.
All right, well, tell us first, when and why did ISMP develop the targeted medication safety best practices?
Well, we started this project back in 2014, and we did it because we were seeing over the last 10 to 20 years the same serious and harmful medication errors being repeated over and over again. So we felt we really needed to focus on these.
And are these best practices limited to just hospitals?
Right now they are, but they are applicable to other settings as well, such as ambulatory and so forth.
Let's talk about the recommendations. What were some of the best practices from the 2014-2015 recommendations?
Well, one of them was to put vincristine in a mini bag. Another one had to do with eliminating glacial acetic acid from all storage areas in the hospital. Using oral liquid dosing devices that only use the metric system, and then finally dispensing liquids in unit dose or oral syringes rather than bulk containers.
And how well implemented were those recommendations?
Actually, for the most part, very well. 75% or greater for most of those, some reaching as high as 90%.
So were any of those 2014-2015 best practices revised at all?
Yes, there were actually two of them where the compliance wasn't as good, and we found out some of the reasons why. So one of them had to do with oral methotrexate. We were finding that we were requiring a computerized hard stop verification, and many people's computer system couldn't do that. So we gave people an alternative to that. And the other one had to do with weighing patients in the metric system only and documenting it in metric system only. And one of the things we found that is kind of buried in the latter part of that guideline was that you actually weigh the patient and not just ask them what their weight was. So we really wanted to focus on that, and so we revised it to do that.
Okay, so moving forward to present day, what are the new best practices for 2016-2017?
Well, one of them has to do with sequestering, segregating, and differentiating neuromuscular blockade agents everywhere throughout the hospital. Another one has to do with using smart pumps for all high alert medications. We find that they're not used in every setting, such as ambulatory or radiology, as well as the fact that using it for all kinds of things like PCA and other areas. So we wanted to make sure that people did that, make sure the software was up to date. Another one has to do with having rescue agents available, such as epinephrine, methylene blue, if you're using benzocaine spray. We were finding that people either didn't have the products where they were needed, they didn't have orders, so they were waiting for a physician to call in an order, or they didn't know how to make it. They didn't have instructions readily available. A fourth one that we did was to eliminate 1 liter bags of sterile water throughout the hospital. This was often confused and hung on patients in place of D5 or normal saline, and that caused severe reactions in patients. Oh, then finally we had one having to do with using sterile compounding, making sure you don't use proxy methods such as a syringe pullback, and that you use technology such as barcodes and IV workflow software.
Obviously a ton of information. So where can people learn more about the new best practices?
Well, the best practices are on the ISMP website, www.ismp.org.
All right. Well, Daryl, thank you very much for this very important information today.
Thank you.